We're going to be doing a plexus shower treatment today on this lovely model. I have decided to use the 1 watt handpiece. Due to the condition of her skin, I feel that we will need that little extra for doing this shower treatment. I have put some numbing on her skin for the past 30 minutes. I'm just going to cleanse. I had already wiped it off. I'm going to do a first cleanse of the skin. I am using the stanhexidine 2%. I'm going to cleanse this upper area. I'll leave the numbing through the lower area for this time. As you see, I have the 1 watt handpiece, and I have put a shower tip into it, and it is extended slightly, and I just give it a little so that I have that sort of downward angle. You turn the tip on. So now we're ready to begin treatment. We're going to divide the face in half, and in this half we're going to have 5 sections. With these 5 sections, 1, 2, 3, 4, 5, it is all dependent on where you choose your 5 sections. My first section is going to be through here on the forehead. Because the device stays on for 3 minutes, I will do a plexus shower. It's a movement across the skin. I hold the skin taut and I gently move the device back and forth across the area for 3 minutes. Different directions, whatever's easiest for you. If you notice, I'm holding the device a little differently than we normally hold the device for the ablative techniques. What is this doing is we are creating thousands of microchannels in the skin. These microchannels will be open for 6 to 8 hours to allow product absorption. Very similar to microneedling, except that we are not creating open injury points in the skin. Plexus shower is also, with this, I am doing it on a dry skin. This will create a microdermabrasion effect, exfoliation of the skin. I'm not worried about singeing any hair. If they have tattoos, I would probably avoid a tattooed eyebrow. These microchannels, as I said, you can apply any product. If they would like to apply a firming serum, hyaluronic, I'm going to choice for today is my Acto Reverse serum for this lovely client. This action also is an antimicrobial, antibacterial action on the skin. So I could treat someone who had acne. I would not say active acne, large pustules, but those that had acne-prone skin. I could do that over their skin with the antimicrobial action. As you see, I'm just continuing over the area, lightly holding the skin taut and lightly. So if there's a concern spot, like here, I could use the corner, or I could use the corner in the deeper right eyes. I'll show you that technique more on the nasal area. 3 minutes is almost up. Here we are, 3 minutes is up. Now I'm going to move to a new area. For us, I think I'm going to move to this eye area. I'll turn the machine back on again. You can tell because the light is shining. There is some, a bit of a sparky, tingling feeling when doing the treatment, especially close to the eyes. I'm going a little slower. I do have the skin pulled quite tight. What are you feeling?
The tingling.
Tingling?
Mm-hmm.
The slower you go with this action, the more the client will feel.
Mm-hmm.
try to go as quickly as you can without pulling the skin too much. I have done this where I have applied a hyaluronic serum or some of the Actofeel products to create a little easier glide under the nose area. This is very important that we concentrate on this area, especially if we're going to be doing that glass lift facial. That's the plexor shower with Actofeel and neurotoxin. I'm going to spend my 3 minutes obviously in the ocular area, pulling the skin tight and just gently drawing it over the surface. You see she's becoming slightly red. That's natural, obviously. It's a very sensitive area. Some people will go more red than others, a little extra erythema. Our 3 minutes is almost up. In the last 30 seconds, I usually do a little bit of a longer draw stroke, which will help pull that fibrin, because it's very important we pull the fibrin up, everything up all the time. We want to create that vector of lifting, and the 3 minutes is up. Now we will start the nose and upper lip area. As you see, I have a little freezing left on the upper lip, which we will remove. Okay. Might as well remove this while we're here. There we are. I'm going to start on the nasal area. I just turn the device on again. Obviously this is problem area for a lot of people for exfoliation. We want to work on softening that pore skin texture and creating those microchannels. A little gentler on the glide. It's a bit sensitive. Try to hold the skin as much as possible. If you notice, I am using the corner through the valley here to pick up as much as possible. Pulling the skin taut over that upper lip. If they're tattooed, I may avoid that lip area for the tattoo, but if they're not tattooed, it's not going to damage to run the device over the top of that lip. I've stretched open the right sides and that nasal fold so that I can exfoliate and create microchannels to administer the product as best as possible. During my last couple moments, I'm going to do a long stroke, which will pull that fibrin. Everybody wants a softer nasal fold. You want to pull that fibrin growth pattern up in order to pull that vector up. I'm working into the corner of the mouth because that's where we wish to soften. And do the end of her nose a little bit. I still have about 20 seconds left. It seems like 3 minutes is a long time, and then it's not a long time. Again, I'm using the tip under her nose into that crevice. And if I choose, I may use it through here and in through here. And the 3 minutes is up. We're going to move on to the next area, which would be the chin and jowl. I'm going to continue on another 3 minutes. So this is 3 minutes per 5 sections for half a face. That in total is 15 minutes per side of the face. In total for treatment would be 30 minutes of this action for shower on the face area. I'm going to use my time wisely here and work in some of these deeper rhytides. And I'm going to want to pull that fibrin vector up. Everybody can always use a really good exfoliation through the chin area. She will go home today, maybe a bit red. She probably feels like a cat tongue licking or a bit of a sparky sensation across her skin right now. I earlier had did this section, so I'm down to my last section on this side of the face. And as we talked, I am going to pull these longer strokes, which will pull that jawline up. Let's do a little lift. We're going to sit her up in a few minutes, and we're going to show the difference between one side to the other, with the immediate result that you have with a plexor shower for a slight lift, a lightening and brightening. Run across that jawline, pulling up, up, up. Always pull up, always vector up. Softening that nasal fold, coming through the corner here, and pulling up and up. And just gently gliding across the surface of the face. I have the skin pulled taut. I'm not applying any pressure to the skin. It's just a glide, gentle glide. As soon as the light shines off, I will have her sit up, and we can then look at the difference between one side to the other. I'm just gonna go a little bit up, and there's the light off. As you have watched, we have done the plexor shower treatment on this half of our model's face. I have yet to do plexor shower on that side. But what I would like to do is I'm going to put some of this Actofeel Acto Reverse serum on this half of her face at this time. I just wanted to show you in this vial, there is 5 ml. And that should be equivalent for 5 facial treatments. I'm going to apply 1 small drop here. And I'm just going to tap that in. I don't want any heavy rubbing, just applying a single drop and tapping it into the area that I have just worked on. The skin is absorbent. As we talked about when we do the plexor shower treatment dry versus plexor shower treatment wet. The dry plexor shower treatment, it's like a sponge. You've created a number of microchannels on a dry canvas. So that sponge will soak up much more product. If I were to, as I discussed earlier, sometimes it is easier to glide under the eye if it's moist. So if you've noticed with our client, we have done the plexor shower for 15 minutes on one side. I divided her face in half. We did 5 sections and I did 3 minutes per section. If you notice, there is a lift on this side. Her right sides are slightly softened. Her nasal fold is definitely softened. We have created a number of micro channels through her face, thousands of them. And what we can do over the next few hours is apply serums. We could apply a serum with a neurotoxin mixed, which will do that glass lift, shower, facial. We can do the Rockstar facial, which is the reverse, the Actofeel serum and shower. And we can do a number of other modalities if you chose to apply on topically. You want to apply PRP. If you wanted to apply other serums, if you were doing a client with acne, some acne, you could apply acne serums, hyaluronic acid. The choices are unlimited, what you would choose to apply with these microchannels. That's about it. I'm going to put the client back down now, and I'm going to finish this